was getting every test under the sun and nothing was coming up, and these doctors would say things like, maybe it's in your head.
My daughter needs morphine. ER doctor said, I don't know, I'm just an ER doctor, but it could be porphyria. And I went,
he said, yes,
I've heard that.
What piece of advice would you give somebody that may be in the beginning of the journey too, like you were?
My advice, I guess, would be to trust how you're feeling.
Welcome to Rarely Discussed, an American Porphyria Foundation podcast with your hosts, Andrew McManamon
and Nicole Castellano.
We have porphyria, a rare disease. Rare diseases differ greatly but share many similarities in how they affect our lives.
Being rare can feel lonely and isolating, but we're stronger together. Join us in meaningful interviews with porphyria and rare disease experts and the patients and families impacted as we connect, learn, and heal together.
We'll talk diagnosis, treatment, pain, mental health, managing daily life, and everything rare. Welcome to the Rarely Discussed podcast. I'm really interested to jump into this conversation with Claire, Erin, and Jim DiPerna, as well as to hear just a diverse perspective about the realities of dealing with porphyria, not just as a patient, but a caretaker, and the aspects a lot of people don't see behind the scenes, along with the sacrifices and the sleeves that I would assume would have to be rolled up to advocate and push for answers. I'm so beyond grateful to have the opportunity to have a conversation with all three of you at once, like I was saying before all this. So I wanted to welcome all three of you to the Rarely Discussed podcast. I appreciate you taking the time.
Thank you.
Yeah.
Glad to be here.
Of course. So obviously we have this perspective of caretaking and we have this perspective of patient, but I kind of wanted to rewind a little bit to essentially where this all started. So, I mean, any three of you can take this away and just jump into kind of how the diagnosis came to be.
Yeah. Claire, do you want to?
Yeah, I was going to say, for me, I think it started or felt like it started a little earlier because I knew how much discomfort I was feeling even before I think my parents fully understood. So this whole thing kind of kickstarted when I got my wisdom teeth out, which was in December 2022, I think. And I'm still not exactly sure what element of it caused my first attack, but right after I got them out, I was just experiencing like crazy pains, especially in my stomach area. And I was having like nausea, vomiting, all these terrible symptoms. And I was like, I don't think this is typical for wisdom teeth. I didn't think so. So I was like, something is really wrong. And it was getting to the point where I was just not sleeping. Like, that's how I knew the pain was so bad, is when you got to the point that you really couldn't sleep. So I told my parents, and I think we kind of went back and forth with some of the doctors or more dentists at that time. And we were like, what could cause this from a tooth thing? Yeah. And they were like, oh, maybe it's infection, something like that. So then it kind of calmed down after that. And I was like, okay, maybe that was just this crazy thing. And then 2 weeks later, I had started having the exact same pains. And I was like, what is happening? I just got over this. I just finally got back to a mental state that I can go back to normal a little bit. It was the same exact symptoms, pain, nausea, vomiting, just terrible, not sleeping. And I feel like mom and dad, that's kind of when you guys were starting to notice just how bad things were getting.
Yeah. Right. After the wisdom teeth, and Claire was our kid who never got sick. You know, Claire, she avoided COVID. She was the only one in the family to avoid COVID. She never missed a day of school being sick. So it was so weird, her being sick. And when she started saying, my stomach hurts so much, I can't sleep, we were just like, so we called the orthopedic surgeon, and they're like, well, for sleep, take some Benadryl. And what was the other thing? Benadryl and...
Well, and they said that they thought maybe it was the flu, right? Didn't they say
something?
Yeah, they did.
They had somebody who was in the day before who called and said that they were sick. Wasn't that it? Claire?
Yeah, I think so. And I was like, I don't think the flu feels like this.
Yeah. But we really had never seen Claire sick. Right. And we were just like, well, maybe she's just, like real sensitive. Who knows, But then when it came back 2 weeks later, and Claire, when she would say, this pain is so bad, I can't sleep. And that really started to resonate with us, because we were thinking, man, when you're sleep deprived, and Claire would say, I dread going to my bedroom because I know I'm going to lay up there. I'm going to have a sleepless night in this pain. And that's when we started digging a little bit deeper. Wouldn't you say, Claire?
Yeah, I would say so. And then honestly, it's very difficult for me because there was so much going on at the time. So I don't even know. When was the first time I went to the doctors? Was it after the second time?
January, yeah.
January.
When we went to see the
physician's assistant. Yeah.
Because Claire was in such a fog. I think that was what, and of course we didn't know. Now I would characterize it as the brain fog, right? Where she just was not herself and couldn't concentrate. She's a bright young woman and just couldn't even put together kind of two thoughts. Yeah. And it became, I think, more and more apparent to us that this is more serious. And then we went on a Tuesday. Does that sound right?
Yeah. It was early in the week.
Yeah. Early in the week. This was the second week of Claire's spring semester. And we went, and they couldn't really figure out what was going on, but they thought maybe it's GI related. Right. Yeah.
And you were anemic. You had elevated liver levels, and you had a wonky urine test. Yeah. And so they sent it away, and we were like, oh, please just let it be a UTI. Please. And then it came back and it wasn't. And we were like, oh my gosh. And it was funny because the doctor is a mile from our house. And I remember saying to Claire, well, can't you just drive to the appointment? And she's like, Mom, you cannot trust me behind a wheel. I cannot think.
My brain was just out of it. Yeah. Oh my gosh, it was terrible.
Yes, yeah. And that too was just like, oh my gosh, this is so weird.
Yeah. When it was later that week. Oh, sorry, go ahead, Claire.
Yeah, I was just gonna say, so there was that appointment, and I think she might have given me some sort of like medicine for gastritis.
Maybe. Like antacid, maybe.
Yeah, I don't know. And that didn't do anything. So then I think I went back 2 days later, and then that's when my sodium was, or that's when she looked at me and she was like, you have to take her to the ER. Like, something is wrong.
They were going to do a CT scan, and they hand Claire this jug of stuff. And the technician said, you need to drink this. Meanwhile, Claire has not been able to keep down sips of water. And I turned and I said, there is no way she is going to be able to drink that. And then when we saw the PA, she goes, Claire, what have you eaten in the past 2 days? And Claire's like, I think I may have drank a quarter cup of water. And the PA was like, you have to get to the ER right now. Yeah. And so we buzzed her to the ER, and that's when they saw the dangerously low sodium levels. So that's really why she was admitted. And the doctor, Claire kept saying, this abdominal pain, and it's all over. I can't even describe it. But Claire is like the doctor said, you are very stoic. So her natural demeanor is always very even keel. And for her to complain about anything physically, I think the doctor just wasn't even thinking she's in terrible pain. I think he was like, oh, she really hasn't been eating or drinking. It's sodium. We're going to admit her. And so she was in the hospital for 3 days to slowly increase that sodium level. Mm-hmm. Claire, would you say your pain was a 10 by then yet?
I mean, it was a 10 day one. It was just like you didn't even know that it could get worse. It started at a 10 and went to like an 11 at some point.
Yeah. And don't you feel like you started to learn that, man, I better let my emotions match my pain because people are not taking me seriously?
Yeah, I think especially when I was getting every test under the sun and nothing was coming up, and these doctors would say things like, maybe it's in your head. I was like, I don't think it is. So I feel like I have to show this because they're not seeing any sort of results that are indicating the state that I'm in.
And wouldn't you say that was really the second time in the hospital where they were really doing everything? So this was, well, I don't know, Claire, if you want to share this part, but 3 weeks later, right? Was it 3
another
weeks later?
attack? Yeah.
Yeah. So it was like I left the hospital and then it was another back to normal relatively, and then the pain would come back, and it was just that was when I went back to the hospital at that point.
That was the week of Valentine's Day in February, I remember. And I was teaching class. I work at Penn State, and I was teaching class on Tuesday nights, and her attacks often would start on Tuesday nights. And I could tell when I would sit down, when we would all sit down, you could just tell her demeanor was starting to change, and that she was starting to get so uncomfortable. And then the further we got into, or she got into it and got along in the spring, it would go from that, right, Claire, to the 11, like you were saying, within the span of a couple hours, is what it seemed like to me, at least.
Yeah. And also, I think we knew when you were really, really uncomfortable. We have this very sweet golden retriever, and Claire is very, very close with our sweet Posey. But when Claire would have no patience, we were just like, we just could tell. That was like our litmus test, that things just weren't, things were escalating again. And so Jim took Claire to the ER, and there's the dog right there. She misses you. She hears you. Right. So then Jim took Claire to the ER early one morning.
Yeah, we went in at like, what was it, like 3:00 in the morning, 2 days later, as I recall. Right, Claire? Sleep.
We thought we might beat the rush, to the ER.
Right. Yeah, exactly. So we went in at like 3:00 in the morning. This was on Thursday of that week. And they, same sort of thing. It felt like that was the other thing, at least I felt, is every time we went in, even though we had just been there 3 weeks beforehand, you felt like you were starting over.
Yeah. Right? There was no one the same.
Right. And no one was familiar with this at all. And of course, at that time, we didn't know for sure. And I just remember them asking you questions, thinking like, we have been through all this already, and they thought it was just severe dehydration. And I think for me, at least, it was at that point where I started to think, this is definitely not any of these things. Right? Everything we've already been through in the span of this is, maybe 5-6 weeks into it at that point. But everything that they were bringing up, we were talking about, we've ruled this out. We've already had this conversation, and we still felt, at least I felt like we weren't really, not that people were trying to be helpful. I don't mean that, but just we weren't really getting anywhere in terms of looking at new things,
new possibilities.
Right.
Yes. Yes.
And
oh, God. I was just going to say another thing. When Claire was in the hospital the first time, we have a very good friend who's very, very wise, and he's an ER doctor in Pittsburgh. And when we were talking to him, he said, if all else fails, if every test comes back negative, there is this very, very rare disease called porphyria. And I wrote it down in my notebook. I circled it, and then I kind of pushed it off to the side because we then were in the process of getting all of these tests. So then,
so that Thursday they sent us home, right, Claire? Like we were there for a couple hours, and they sent Claire home. They gave her IV fluids, and this could just be severe dehydration. And I remember when they took a urine sample, seeing it.
It was dark.
And it was dark red.
Yeah.
And I thought, that's not
normal.
Is not normal dehydration. Yeah. There has to be something else going on here.
Yeah.
So anyway, when they sent us back and they said, well, see how she does for the rest of the day. And I think you were able to sleep a little bit that day. But by that night, we were right back. It was even worse.
Yeah.
And she was feeling so awful. And so that next day we took her back to the ER, and that was the first time where somebody in the ER said, I can't remember if we mentioned it to them.
Yes.
First.
So Claire and I were there, and we were going through the whole thing all over again, not having the same doctor or nurses. And they were going to do a CT scan, and they were going to do this and that. And finally the ER doctor said, I don't know, I'm just an ER doctor, but it could be porphyria. And I went,
he said, yes.
Yes, I've heard that.
Right.
Tell me about that.
Mhm.
And so you then remember, did she get tested then
So
that day?
they said that day that they were going to do all these tests, and
Mhm.
we said, and our friend actually called us
Mm.
while we were sitting there because he had heard that we were back in the ER, and we were talking with him about it as well. He said, make sure they're going to do that test. And they said, absolutely. We're going to send that off as well as do all these other tests, many of which they had already done before. And they said, but it has to go out. I don't know if they said it that day, but they said, the test, they told us maybe within the next day that the test had to go out to California to be actually run.
Yes. So, and that was a Friday.
Right.
So by the time it made it to California, it was a long
Right.
week. Let's just say that.
I was also going to say, I know I did that test while I was admitted. I wasn't in the ER because I remember there were all these rules about it. They were like, your urine sample can't see the light or something
Light.
like that.
Yeah.
Yes.
So I remember it was like they made me go into the bathroom with all the lights off and stuff like that and keep it covered.
Yes. Yes.
So,
yes.
yeah. I was like,
but
I
when
remember
Claire-
that test.
Yeah. But when Claire was in the hospital at that point, that's when it was like, I thought for the first time that pain was so intense that I went running through the ER and like kind of through tears and through my mask. And I was like, if someone doesn't get in there right now, you're going to have a medical emergency on your hands. My daughter needs morphine. And I felt like, oh, what's the name of that movie? I'll think about it. It's from the 80s where the mom runs around the ER, saying that her daughter needs morphine. But it was Shirley MacLaine. Not Steel Magnolias. The Terms of Endearment. It was my Terms of Endearment moment. I was like, my daughter needs morphine. And so they gave it to her. They gave it to her, but I think they were very hesitant. And we now know that that's the only thing that takes the edge off.
Or something of that level strength is the only thing. Yeah.
Right.
Yeah. I mean, the extra strength Tylenol just wasn't doing anything, and that seemed to be what they kept, giving you.
It was over the course of that weekend then where, again, they had a kind of staff change and we were going through all these and they were bringing up things about, they went to a psych consult and all these things. And we said,
surgical consult,
if you want
go
to
ahead.
do that, but we know our daughter and that's not what the issue is here.
Yeah.
And it was really after that weekend for me, at least. And, that Monday where they had run all these tests, they hadn't gotten anything back. And we were asking over the weekend, but did you send out the porphyria test? They said, well, we're going to check. We don't know if it's gone out yet and everything. And I thought, what are you waiting for? And that Monday I was leaving in the evening and Claire was in such pain. And again, they were very reluctant to give her much morphine because they didn't know the diagnosis then and concerns about, all this stuff. And when I was walking out, I saw one of our doctors and I was talking to him. He said, it's just a puzzle to us. Like we don't know what's going on. I said, we've ruled out everything else. I said, do you think it could possibly be porphyria? And they said, I don't know. It's so rare. I'm not that familiar, and I thought at that point, I was like, but it's the only thing, what little we knew, it was the only thing that potentially explained this. And so I drove home that night, and this is where the foundation. So I drove home that night, and I don't know why I didn't think of it before. We didn't think of it before, but I'm like, there has to be more information about this. And I found the foundation's website that night and was reading through it. And the more I read, the more I'm like, this has to be it. This, this unexplained pain, all these things, kind of a family history of those sorts of things, which my mother had, what we didn't know, but we now know was probably a porphyria attack in her 30s.
Yep.
In the 1970s, it was a response to
medication,
a medication that she had been given, but so just these different things. And so I read that and that night I went to bed thinking like, okay, I'm going to call first thing in the morning and see if I can talk to somebody at this foundation and see if they have any advice. And so I did. I got up and I waited till 8 and I called and this woman answered the phone and said, hello. And I said, oh, hi. I said, I'm sorry. I said, I'm trying to reach the American Porphyria Foundation. And she said, oh, no, you've called the right number.
It was Desiree.
It was Desiree.
Yeah, that's awesome.
Yeah, which was great. And you know, and we chatted for, as I recall, about 20 minutes. And I just said, my daughter's in the hospital. We're kind of trying to figure this out, you know, and we had this great conversation. She was great. And this conversation I shared with her a little bit. And she said, well, you know, I'm not a doctor. She said, but based on what you're describing, it sure seems like it's a possibility. And then I can't remember how we established. I must have mentioned we were in Pennsylvania or something. She said, "Oh, maybe I asked her about doctors." And she said, "Oh, we have Dr. Smith, who's on our board, who's in Pittsburgh, and he's this great doctor." And I said, "Oh," and I asked her. I think she gave me his number. I can't remember. And so she was very helpful, to say the least. And as soon as we hung up, I called his office. And I said this to Claire and my wife. Somehow, miraculously, his head nurse picked up, and we found out after that it's pretty rare for her to pick up because she's always so busy.
Yeah.
But she actually picked up right away. I got connected to her, and I explained the situation. She said, "Well, we can't, you know, we couldn't see your daughter unless she has a diagnosis." And I said, "Well, are there things that we could do that you would recommend?" And she said, "The first thing I'd recommend is that you get a hematologist to." She said, has she been seen by a hematologist? And I said, I don't think so. And she said, I would ask them to get a hematologist on her team and talk with the hematologist. And then she said, and I said, well, can we get on your schedule? So we set up an appointment in case we got the diagnosis. But so as soon as I hung up there, I called Erin. She was at the hospital, and the team was there. They just had another shift change, or, you know, their team change after 5 days. And fortunately, the hospitalist who came on was very open-minded about things and was really asking us, because they had ruled out the psych, right? Claire, you'd had the psych interview the day before or whatever.
And the psych interview was basically, why don't you want to eat that tray of food? And Claire said, the pain that I will feel if I eat that tray of food. And the psychiatrist said, that is not an eating disorder. That is not a cycle. You know, usually you would feel nausea, and she disregarded it. She was out the door within 5 minutes. We were like, thank you. Okay. Okay. And so we were very thankful for that. And the surgical consult, they immediately, you know, so we feel very fortunate about that.
Yeah. That had, and I think that by that point they had realized that they had really run out of things to ask about at this point and to test for it. And they had done everything possible at that point. And that's when I called, and I was on speakerphone with the new team, and I said, hey, can you get a hematologist to come in and talk with us? And they said, yeah, we will do that. And so I felt like that was a real turning point where we at least started to gain some traction with talking about this as being a possibility. And then that night, actually, I don't know, Claire, if you remember this, because you were on morphine at that point. And the hematologist came in I don't think you were there.
I wasn't.
I remember that. Yeah.
I came over after my class, and I was there. And fortunately, the hematologist came in, and we talked for almost an hour. And I was explaining to him all the background. He said, and towards the end, and he was pretty senior in his career. And he said, I have to be honest with you, I've never seen a porphyria patient. He said, I really don't know that much about it. And he said, when I first came in here, I was doing it sort of I don't know if you guys said this, but he was saying, when I first came in, I wanted to listen to what you had to say. He said, now we've gone through all this, he said, I can see why you think that this is a real possibility. He said, I'm going to look into it further. And at that point, I felt like then they were really looking into it, because the next night he came back and he said, I'm going to check on this. I said, do you know where the test is? And he said, I don't know, but I will check first thing in the morning, which he did. And he said, we've called, we've asked them to expedite the test. And he came back that night. We had another conversation. He said, I spent some time looking into this. He said, I think there's a reasonable probability that this is what the problem is. And it was at that point where it was finally like, yes, somebody gets it and is now trying to, sort of advocate on our behalf to expedite things. And it was 2 days, like a day and a half later, where Claire, I don't know if you want to jump in at this point, where you texted us first thing Friday morning, right?
Right.
Yeah.
And at the point was 20. So since she was older than 18, we were, and this was kind of coming out of COVID. We were still wearing masks. And so we were forbidden to spend the night at the hospital. So we had to leave her every night. And it was terrible for us, unbelievably terrible for her, but for us to have to leave her was heart-wrenching. So we would just wake up that morning, eat breakfast. And so as we were about to have breakfast, Claire called us or texted us and said, I think Claire, you texted and said, "Oh, I got some more urine results or whatever." And
it was because
it's not a UTI. I was so fed up. And then go.
I was just gonna say, because I had the portal on my phone, so it felt like the routine was just every morning, like see what they had tested and what came back, and everything was always like pretty much normal. And I remember picking up my phone and it was like, oh, new test results, and I click on something and I'm like, porphyrins, oh, that's a new one. And then I look at the test result and it's like the range was like 10 to 50 something, and mine was like 10,000 or something like that. So it was like, and I was like, oh my gosh. And I looked at the little analysis of the test results and it was like acute intermittent porphyria is very likely. And I was like, finally something. So then I called you guys immediately and I was like, there was a result. And something finally came up.
Oh my gosh. Oh my gosh. I will never forget that morning. I will never forget that day. I mean, what a relief. So I can't imagine people who have long years of, I mean, 2 months was plenty. That was really, really tough. So we were thankful that it was so short.
So how was it once you got that diagnosis? I'm sure it probably felt pretty good knowing that you actually had an answer, but I mean, was there still an uphill battle after that?
Yeah, there was.
That's not even the midway point of the story.
It's not.
That's what I thought.
Yeah, I don't know, you go first.
I was just gonna, I mean, it was tough because I knew, or once I got the diagnosis, I was kind of naively thinking, oh, now things will be so easy. When I tell them I have this, they will be willing to give me what I need in a timely manner and just listen to me completely. And it was still definitely a difficult situation just because of how unknown the disease is. So it's like I would come in and be like, oh, I have porphyria, and then the nurse or whoever would be like, what's that? So there was still definitely a disconnect between the treatment and getting it quickly, because that was another thing we figured out was like the quicker I could get panhematin, the easier it was for the attack to resolve. And I feel like that urgency wasn't always translated. It would be like I would be waiting for hours to get my first dose of heman.
And so also the morphine, tough. When you say, like you were scheduled to get it, and even if it would get to you 10 minutes late, Claire would, and you saw a lot of that, like just the in a 10-minute span. Go ahead and talk about that.
Well, I mean, it just would go. She would go through the roof in pain, in terms of pain, and it was telling. So that day, so she got the diagnosis. We went into the hospital immediately. The hospitalist came in and said, we've gotten these results, and kind of filled us in what she had already told us. And because I'd already had contact with Dr. Smith in Pittsburgh, or his office, we had told him, I said to him, hey, I've already had this contact. Can you please reach out to them? And he said, and they did. And Dr. Smith said she has to get down here immediately. And so they arranged for a transport that day. And so she had to be transported. So we live about 2.5, almost 3 hours from where Dr. Smith, the hospital, he's at UPMC in Pittsburgh. And so we're thinking, great, well, she'll get there. She'll now be able to, because they didn't have hematin at our hospital at all. I mean, and so, but then it took 48 hours
to get an
ambulance. They could actually get her there.
Which we should have just driven her.
Yeah. I mean,
because the attack by then, what you say, Claire, was kind of over.
Right? Yeah.
But we waited around for 2 days to get the ambulance, to get down there.
And so and we're sitting there. I mean, we're just kind of waiting. And I think part of it was that they didn't have a room that they could move her to.
Yeah.
There. I think that was part of the delay. But But then when she got there, it was now Sunday night, and they immediately wanted to do the hematin, even though her attack was starting to subside a bit.
Yeah.
I mean, I think you were still right in pain though, right, Bearsy, as I recall.
Yeah, it was definitely on the downside. Like, I don't remember. That was what was kind of inconvenient, was it was like, I'm finally getting this treatment, but it was over at that point, so.
Mm-hmm.
Yeah.
And I think what was so, for me at least, so we get there, it's now Sunday evening, and we didn't have any experience with this before. And they said, well, we're going to have to put in a line so that she can get it, close to the heart. And we're just thinking, like, what is this? And then you see the actual medication, and it looks like motor oil.
Right.
Thinking, like, that's going to go
into our daughter,
right?
And,
and it was clear too that even though we're now in the place where there's a specialist who's internationally known, that the people on the floor didn't really know much.
Yeah, they're like, I've never given this to a patient, and we just kind of sat there. That first night, I remember we just prayed. Thought, like, okay, please do what it's supposed to do, and
have everybody do it correctly. I think that was the other thing, is just, do people know enough? I mean, we were kind of hearing from them about, well, there are these instructions, right, that it has to be mixed and delivered within 30 minutes
hour.
Or 60 minutes or whatever.
Yeah.
Right.
And then if it's mixed with albumin, then you don't have a filter. And if you do have a filter, then the filter we had another nurse.
Like, we learned that after Claire had some challenges with that, to say the least. Not necessarily on that visit, but on the next visit was really.
Where you have nurses who aren't interested in helping to get you answers to be able to give the medicine properly. Okay, Claire, go ahead.
Oh, I was just going to say, and at that point, I was thinking about why I had the central line, but at that point, I remember my arms were just so bruised, and they couldn't even, like, get anything in my veins at that point. So I think that was part of the reason I got the central line immediately, but then the visits following that, they were trying to just use my veins. So then that's when it was like, do we need the filter, or do we need a mix-in? So it just
and then the central line, when Claire, that first visit to Pittsburgh, had the central line, her heart rate was skyrocketing. So when she would stand up, her heart rate would be average 170. And we would just sit there and look at this monitor and go, what is she going to keel over? I mean, this is not right. And they eventually thought that, like, the little part of the central line was kind of dangling too close to her heart. So once that got removed, we were like, okay. But then we really didn't know after that if Claire was going to have another attack. And,
And even, at that time, so that was when we first met Dr. Smith in person. He came up the next day, and we saw him a couple times, I think, right, Claire, on that visit. So Claire had spent basically like almost a week, or a little over a week, in our hospital, and then went down and was transferred to Pittsburgh and was there for 5 days. Is that right?
5 or 6.
5 days, or so. And like you said, when she got there, her attack was starting to subside, and then she got the hematin for 4 days. So those 4 days were pretty stable.
But wouldn't you say physically it was stable, but Claire, you were starting to kind of lose it?
Oh yeah, I wanted to leave.
Yeah,
I wanted to get out of the hospital.
So there was your physical part is taken care of, but then you have someone who has been kind of locked up in a hospital for 15 days. And that male nurse, remember when you kind of lost it, and he's like, so what's the problem? And you're like, I've been in the hospital for 14 days. I've not breathed oxygen yet,
I was going to say, it was just something about not being outside. I was like, I just want to go outside and sit for a little bit. Like, this is too much.
So we arranged it. We got her in a little wheelchair, and we got her to sit in, like, the garden out there, and we just sat. And we just sat, and you just breathe fresh air. So it's the physical and emotional that was really tough.
Yeah, it really was. And I remember getting out from the UPMC. It was like kind of a long distance for me to be able to go out and sit outside. And before this, I had been pretty active, but I remember I would need to, like, take breaks to walk outside and stuff. Like I think at that point I had lost like 25 pounds or something.
Yeah.
And I was just like, my heart, I just couldn't.
It's very tiny to
Yeah.
begin with.
Yeah.
Yeah. So I remember that was even an ordeal. Like it was exciting when I could go down to the exit without having to stop and catch my breath.
Right.
Yeah.
It's very similar to mine.
Oh, really?
Definitely.
Yeah.
I mean, the same thing with the IV situation too. Like when I first got panhematin, it was through an IV, and I ended up getting a bunch of blood clots. So
did you have an
and then we
infiltration?
realized,
Yeah.
I mean, I ended up just getting a PICC line later on, but they rotated arms because they thought, oh, we'll just do a dose of panhematin here and a dose here, and I was like, that stuff's way too thick to be doing that. So
Yes.
I ended up getting the PICC line. So
that was about 4 stays later where Claire had an infiltration and
my arm turned blue.
She looked like she was from Avatar. You know, she was the Avatar.
Yeah.
But what I was going to say at the tail end of this trip, the first trip to Pittsburgh, there where we had gotten the diagnosis, we knew about the hematin at that point. I still remember Dr. Smith talking to us and saying, "Well, you know, Claire's young, she's healthy." He said, "You know, this could be her only attack. Hopefully, it is her only attack, and you know, and you don't have to come here. We don't see each other." And I remember thinking, like, yeah, that's my hope. And he mentioned in passing, and because I think I asked, or one of us asked, well, what if it isn't, right? What if she has more attacks? And I think that was the first time, as I recall, that he mentioned, he said, well, there's some other medication. He said, there's this medication, and I assume he said Givlaari at that time. I didn't register, and he said, you know, so people who have rapid attacks, that's an option for them. And he said, many people, not everybody, he said, but many people do experience at least some relief from that. He said, but, you know, Claire's young, first attack, or maybe her second attack. I mean, really, it was probably her third attack at that point. But, you know, that's something, you know, I remember him saying, we're nowhere even close to that, or that was my takeaway from it. But, you know, 3 weeks later, we were back there again. In Pittsburgh. And 2 months later, we were having a serious conversation about how she really needed to get on. We needed to try Givlaari.
Other things,
because of everything that transpired. And, you know, so when we went back in March, it was actually the appointment I had made on the phone 2 months earlier, you know, 8 weeks earlier, we went for that appointment. And unfortunately, Claire was able that time to get the panhematin as an outpatient. She was starting to have an attack, right, Claire? Wouldn't you say you were kind of on the upswing when we got there, but then you didn't have to be admitted that time, right?
Yeah.
At all, which was great because she got the hematin in enough time that it broke up the attack.
Yeah.
But then 3 weeks after that was when, 3 or 4 weeks after that in April was when it came on with as much intensity as any time before that, if not more, right, Claire, would you say?
Yeah.
And it was, again, I remember, sorry, were you going to say something, huh?
Oh, no, I was just agreeing.
Yeah, it just, I came home from my class on Tuesday, and I could tell that she was not feeling well. And by Wednesday morning, you know, she hadn't slept through the night, and we were talking about, okay, we probably need to go into Pittsburgh because we couldn't go to our local hospital to get that at all. And understandably, you know, she was really concerned about doing that because of all the challenges we had in the hospital. And I think, would you agree, Claire, that I think it had started before that, but that was the point at which, like, the anxiety about the experience and sort of trauma that was going on that coincided with those experiences really, would you say you were really starting to feel it at that point?
Yes, I would say that's when it was more of a mix of mental and physical. I mean, it still had been mental and physical up to that point, but it was just something about going into an ER or hospital or whatever and having to explain something for the millionth time, or to make a request and them try to fight back against it, even though that's how this disease is treated. I was just kind of like sick of that. I was like, I feel terrible, but I don't want to deal with this. So it was really just like is it that bad that I need to go in? And then when I couldn't sleep through the night, I was like, okay, I have to go in.
And
Yeah.
and would you say, I can't remember if it was that time or the next time, Bears, we were driving. So we would drive into Pittsburgh, and we were driving in that day. And is that when you had the panic attack in the car, or was that the next?
Maybe I had one with Mom. I know that. I don't remember.
Yeah, I
Was the
thought that was
one?
my illustration. The one where we were driving in, and just understandably, we got within about 5 miles of the hospital, and Claire just didn't want to go back into the hospital.
Oh, yeah. Yeah. Okay. I remember that. We were literally in the streets of like Oakland. And as we were approaching it, in my mind was just going back. I was not having it. I was like, I don't want to walk into that building.
Yeah. And I think, what happened when we went in April. So we went in and we were thinking, at least I was thinking, at least everybody there knows Claire now.
Yeah.
We have this plan in place. They should know, it's in her records, what they're supposed to do as soon as we get there, as soon as we get to the yard, because we called in advance, and they said, and that was the case, at least initially. But for whatever reason, that the first part of that stay, it was again starting almost from ground zero. I mean, Dr. Smith was involved when he was there, but things were not being communicated. I think the plan was there, but I think they had a lot of new staff, just in general, from what we understood at that time, and a lot of people who weren't familiar with this at all. And even that night, so I was there with Claire until, I don't know what time, when they took you up, maybe like 10 o'clock at night or something, but I wasn't able to go up. And I went home, or went back to my parents' place, who still live in Pittsburgh, and eventually got to bed probably at like 1 o'clock in the morning. At 4 o'clock in the morning, my phone was ringing. And so I immediately picked it up, and it was Claire, and she was really upset. And she said, "They won't give me my morphine." And I thought, what do you mean they won't give you your morphine? Like, we've been through all of this.
Yeah.
Right. And for whatever reason, they didn't either look at the plan or didn't have the plan. And I said to Claire, "Is there anybody there? Ring the nurse, whoever, put them on the phone." And I was, talking with this person at 4 o'clock in the morning, saying she has to have her morphine. There should be a plan in place. She cannot be allowed to, suffer in pain this way. And the nurse said, "Well, I don't have the authorization, right, to make these changes or anything." I said, "Well, who does?" I said, "Get them on the phone." She said, "Well, I'd have to get the, resident in charge or whatever, the overnight." I said, "Get them on the phone." And fortunately, eventually we did. And I said to them, like, and so I think they did eventually give that to you, right, Claire?
Yeah, I think it was like a few hours or something, or maybe an hour or so.
Yeah. So, it was probably an hour before it was
an hour
resolved.
too long. Yeah.
And so so there's that. So, again, we went in there, or at least I went in thinking like, it's going to be much better.
Yeah.
And unfortunately, it just kind of went downhill from there for the next few days, where because of that, they said they were going to set Claire up eventually with a pump so that she would have control over it. But then what we realized, because the next night it was the same thing, right, Claire, where you were in so much pain, even though you had the pump, and here they set it up wrong.
Yeah.
They should have set it up where you're refilling, where they give you a big dose and then they start the pump. But what they did is they waited until the previous dose had ended. And so she was always trying to catch up rather than replenish. Mm-hmm. Right. And so we went through that for 24 hours. You went through that for 24 hours. Yeah. And then, like Erin was saying earlier, then the next day we were saying, this can't happen. And what are we going to do to ensure this doesn't happen? They assured me it was going to be fine. And 3 o'clock rolls around that afternoon, and I could tell Claire had just woken up, and I could tell her morphine was starting to wear off. And I went out to say, I said, "Look, she needs to get this as soon as she's, able, because of the 4 hours or whatever." And they said, "Well, we'll be down. And, 15, 20 minutes after that was when, it was surprising, to say the least. And unfortunately, Claire had to suffer as a result of that. And then even probably the low point, at least for me, was then that Friday night when the whole reason we were there was for her to get Hematin. And because they started at night, they had to wait 24 hours, right, for every dose. And so after this incident where she didn't get her pain meds in time earlier that day and had such an onset of pain and attack, then after all that happened, we had people's attention again. And I said to them, they had a shift change. And I said, okay, I just want to make sure that Claire's going to get her hemotin at 8:30 tonight, because that's when it's supposed to be scheduled. And the new nurse looked at me and said, no, I'm sorry, but it's not in her orders. And I said, what do you mean it's not in her orders? I said, that's the whole reason that we're here, is to get this. And they said, I don't know what happened, but it's not here. And it's now like 5:30 on a Friday. And I'm thinking, like, how are we going to get this, order for her? And so I made several calls, and fortunately eventually got Dr. Smith's resident at like 7:30 at night. And he said, I'll get it up there. And so, it's just the first 4 days of that were almost like we were back at square one 2 months earlier. And again, I don't think it certainly wasn't intentional or anything, but just that it was so eye-opening to us.
Yeah.
How even though all these things had happened and we had a plan in place, that I think what you had said a while ago, probably at this point, like in terms of advocating, right, and having to be on top of things to make sure that Claire was getting what she needed. It was, we realized that we couldn't
ever let our guard
right,
down.
that we had to be really vigilant about that at all times when she was in the hospital.
Yeah, yeah.
So how does that look present day now? I mean, is there still the starting from scratch situation?
No, I mean, to kind of jump ahead, I mean, at this point, I haven't had an attack since I've been getting treatment. So I haven't had to go back into the hospital. So hopefully it wouldn't be a starting at scratch, but at least as things were kind of wrapping up and I was starting to get the attacks under control, and I had is it complex care plan in my files?
I have it right here, Claire.
Yeah. Once I had that in my files, it was a lot easier to easily communicate with whoever the person was taking care of me, even if they didn't know what the diagnosis was. It had a good summary of what needed to happen so that I could be taken care of. And
that's that's one thing I'll definitely give a shout out to Erin about, because it was after that stay, right?
Yes.
Where we had so many problems, and the latter part of that stay got even worse.
Yes. With a blood infection and terrible.
Yeah, it was just awful. But coming out of that stay, then Erin took it upon herself to make sure that we had printed copies of the complex care plan, and we would give it to everybody and anybody who would come in contact with Claire. We just hand them out.
Yeah.
And even if it was down where they already had it on file and we're supposed to be looking at, we just made sure that everybody was aware of that, and we could reference it for them.
Right.
Yeah.
Well, and I feel like, especially for the next year, if Claire left our site, I mean, I feel like she was like a newborn baby to us again. You know what I mean? And it was like, Claire, you going to Wegmans? Take your complex care plan. You know what I mean? Like, we just anywhere she went, I had one for her suitcase, and I had one for each of her siblings, and I had one for her best friends, and anyone who would be in contact with Claire, they had to have it. And so thankfully we've not had to use it, but the advocating that we had to do, which just with it being such an acute pain and such a how much the patient suffers, it seems crazy that we had to do the advocating that we did.
Well, and that's the kind of, so it was the end of the stay that we've just been describing. When we came home, we got home, it was the beginning of May, and Dr. Smith called us, and we had seen him, of course, many times or several times during that stay, especially, and then once she got over the blood infection, was finally able to come home, and he called us the day we got home.
Yeah.
And that's when he said, and going back to what I had shared from the first time we were in Pittsburgh, and he said, listen, I really think we need to pursue insurance approval of Givlaari for Claire.
Yeah.
And we said, okay, we wanted to think about it a little bit over the weekend. And he said, that's fine. He said, but he said, I need to tell you, their insurers sometimes will really fight this because of its expense. And the sooner we can start that process, the better. And so the three of us talked about it that weekend and called first thing Monday morning and said, yeah, let's go ahead and get it started. And it ended up being great that we did, because when was it, Claire? 10 days later, we were going back. We had to go back to Pittsburgh because Claire was starting to not feel well again. Yeah. And so I was saying to Erin before we got on the call, it's almost exactly 2 years ago to the day where she eventually, so we went and we tried to do outpatient the first, and that's what you were talking about, Claire, when we were walking around in Shadyside in Pittsburgh, trying to keep from going into the hospital and just keep things as outpatient. But it was that morning, the second day that we were there, where Dr. Smith said, no, we need to bring her in, but I have good news. She got approved for Givlaari.
Yeah.
And so the beginning of that last, well, it wasn't quite the last day, but like I said, it was it'll be 2 years, I think, on Wednesday or something, or tomorrow.
Yeah.
That Claire got her first dose of Givlaari.
Yeah.
And so far, I feel very fortunate that it's made a big difference.
Right.
Her.
Yeah.
So it's just been Givlaari then from here on out, or from that point on?
Yeah,
it's just
that's
been
what
Givlaari?
it's been.
Yeah, that's what it's been right now. And it was actually, I also have a port now because of the infiltration that I got. So if I would have another attack, it's nice knowing that there's a much easier way to get the panhematin if necessary, because by the end of that process, I was also so traumatized by, I mean, I think everybody doesn't like needles, but I was especially traumatized by needles that it was nice to know that if for some reason I need to go back into the hospital, it would be a much easier treatment process rather than waiting for somebody to put in a line or something like that, and then having to delay the treatment process even more. So
Gotcha.
Yeah.
And I wanted to switch gears a little bit, just out of curiosity for me, and just I went to the conference in Pamplona, Spain for Porphyria, and I met a lot of young people with Porphyria, and I was interested to ask you, because you're young too, and when I was diagnosed, I was about 2 years into college, and one of the attacks I had, I was playing college hockey, and I'm now looking back, I realized that attack was triggered from overexertion because we were practicing and playing and off ice training, and that was 5-6 days a week, which is something I never did before. And doing all that and just being in a college setting, how has that been for you, just with the people around you? Because I mean, obviously it's not high school anymore, we're not as childish, but college, you still have a little bit of that childish thing going on. So I'm curious, like, how that experience was for you, because when I went into the hospital for 7 days in playing college hockey, people were like, what's wrong with you? Like, why are you in the hospital for 7 days? You dying or something? Like, what's going on?
Yeah,
So I'm curious how that was for you.
Yeah, I would say the biggest thing was it just showed me who my true support system was. Like, I've always had friends and stuff in college, and I really enjoyed my experience in college leading up to that. But I could tell who my closest friends were after, because they made such an effort to understand what I was going through. And they would make an effort to ask me questions, to kind of educate themselves, make sure they understood what was going on. Or if I was like, I am in pain, I can't do this, they were like, yes, we get it, we understand why. I think something that was a little difficult for me was I got diagnosed right around my 21st birthday, and I can't drink anymore. So I remember my 21st birthday, there were people coming over and they were like, oh, can you have this? Congrats. Are you ready to go out to the bars? And I was like, no, I'm not. So that was definitely a little weird that it happened right at that time. But I think it's all just a perspective of, like, as long as I'm not back in the hospital, I'm happy. So, or even if I would be in the hospital, now that I have a treatment in some way to manage this, it's fine. So it's just like some smaller adjustments, like the not drinking, once again was showing like who my close friends are, because if it's like someone who still wants to hang out with me even if we're not going to a bar or something like that, they still make an effort to see me and not do something that I can't do. Yeah, I would say that was the big thing, was just learning like who the really close friends I had around me were, and they made an effort to understand what was happening to me.
Yeah, because it's easy when you're that age to be like, ew, you're the weird kid. And it's just like, it's not an adult thing. It's like, oh, you got something wrong with you. I don't want to be around you.
Yeah.
And I mean, that's the reality of it. I mean, that's just how people are when you're that young.
Yeah.
But
So,
I think go ahead.
Oh, Andrew, I was going to say, so then after Claire's diagnosis, then we started to do the genetic testing to see, where all this has come from. And now that we know, that Jim has it and his mom has it and his brother has it, like there's kind of an interesting story with that. So, is it okay if I tell that?
Are you asking me?
Yeah. Is that okay?
Yeah, of course.
Oh, okay.
Yeah.
So about 10 years ago, we were at the beach and Jim do you want to describe your pain?
Oh, I had major, like my back and I've had since my 20s, I've had back pain, like lower back pain. And I've had two, and this one that Erin's mentioning in particular 10 years ago, where it just, my back gave out on me, or that's what I thought at the time, where I couldn't walk. I couldn't do anything. I couldn't walk. We were down at the ocean on a vacation, and went to
and he couldn't get out of bed.
Went to the hospital there and was just in such pain, such intense pain, and that lasted for almost a month. and they couldn't, I had all kinds of tests. They couldn't identify anything. I'm otherwise healthy, and at the time we didn't know what that could be, but now knowing what we know, right, I mean, I have no idea if that really was an attack, but it sure seems like I had even mentioned it to Dr. Smith when we got to know him. He said it seems certainly possible that could have been. And even going back into my 20s, I didn't have anything like what Claire had back then at that age, but I had, some GI, like unexplained things that I didn't know. And I still, again, don't know if that's what it was, but now knowing what we know, it makes me wonder if it was where I was starting to experience symptoms as well at around the same time Claire did, but not with the same intensity at that point.
Yeah, it seems like this is a common age for people to start getting some of the symptoms. I'm not sure what it was like for you, but it seems like the college age, some people I've talked to have had that as well.
Yeah. Do you think it might be kind of the alcohol piece, that you if that's a trigger
as well?
I don't know.
Yeah. So then Jim's brother got tested, and Jim's brother tested positive for porphyria
about 15 months ago.
Yeah.
And so I mentioned before with my mother, I mean, once Claire had the diagnosis, I was almost positive that I had it and that my mother had it, partly because of what I had shared, earlier, where she had this episode, and also a longer history of unexplained things,
abdominal stuff.
And so I was not surprised that she and I had it, but then my brother also tested positive, and he and his daughters were here, my nieces were here, and we were talking, and his first test was spoiled, and so I asked him, I give him a new kit, and then they were back here, and I said, oh, did you get your test? He said, oh, actually, I meant to tell you, I got it, and I did test positive. So this was in like March of last year. He said, so I just scheduled a time, I'm going to go meet with my PCP to make them aware of it. I said, great, all that stuff. And here, his PCP then said, well, let's get a baseline of, kind of blood work and everything. And so they did that. And when it came back, he had these abnormal results, and they immediately referred him to a hematologist. And here he has a rare form of leukemia called hairy cell leukemia, which is very slow progressing and often goes undetected for years before. I mean, there's some parallels to the porphyria here.
Yeah.
But the thing that I'm sure he would say as well is he would have never found out when he did had he not gotten the porphyria test, and his PCP not thought to do, just kind of a baseline blood panel. And so fortunately they caught that much sooner rather than later.
Right.
So we feel there are little things. It's hard to say there's silver linings to all this, but there are little things like that try to, I guess, sort of hold on to as things that came from it all.
Yeah, they're definitely blessings, that's for sure. And as Claire said, with her knowing who her true friends are, I just feel like we were so well taken care of by our neighbors and our friends and our family. Mm-hmm. And, it was really the scariest time of our life, not knowing what was going on with Claire. And then even after we had the diagnosis and she still wasn't getting the proper care, we were taken care of by our friends and family the whole way, which, it's nice to know that people have your back. So that was pretty cool,
Mm-hmm. Yeah. And something I want to ask too is, so with porphyria in and outside of an attack, and a lot of people don't always talk about it, but I always like to bring a point to ask about it, is just the mental health aspect. Mm-hmm. Is even when attacks aren't happening, there is that crippling emotional aspect that literally could leave you in your bed. And there's a lot of people this happens to. It's happened to me for sure. Mm-hmm. I mean, you could get down a rabbit hole in your head about, geez, porphyria, it just keeps going. Mm-hmm. So I wanted to ask, how is that for you? How are you coping with it? Do you have hobbies you do? Do you walk? What's the thing? What's your porphyria coping thing?
Yeah, I was going to say, especially immediately after I had started to get things under control, there was just that voice in my head that was like, what if it comes back? What if you do? Right. What if things go wrong? And that definitely brought me a lot of anxiety especially at the time. And I think a big thing for that was I started going to therapy for a bit, and that helped. Also, journaling was really big, just being able to write down my fears and try to rationalize through, like, I haven't had alcohol, I haven't exerted myself, I haven't had a surgery that could trigger this. Just tell myself that I haven't done anything that should trigger it. Mm-hmm. I do like to stay active, and I'm more of like a jogger. I wouldn't say a runner, but I would say like jogging or going for walks is really big, especially after spending so much time in the hospital. It really made me even more excited to just be outside. I think at least once a day, I'm like, I just need to get outside, kind of clear my head, rationalize through things, be like, there is nothing immediately happening to me right now. I am steady for a time. I think also just being grateful for, my parents, obviously, but just the fact that I can have some level of normalcy or some level of downtime is so nice. And honestly, the really painful parts of what I experienced make me more grateful for the time that I have now. So I think being able to focus on that stuff is really exciting, because I'm like, I'm doing exactly what I need to be happy right now. Like, I'm so great right now. I'm not in pain. That's all I need. Yeah, I would say as long as I'm staying a little bit active. I love hanging out with my dog. She always makes me excited. Yeah, I would say just having some hobbies and some kind of down to earth moments of like, I am okay right now is kind of what I've been using to cope a little bit.
Yeah, I mean, when you look at the, I don't even want to say positives because it's not even true, but if you could pull a positive from porphyria, it's the fact that it grounds you that much more. Yeah. It makes you look at those little things that a lot of other people overlook so much. Mm-hmm. I feel like you're just grateful for so much more, and you're outside, and maybe you're just throwing the electronics away, and you're like, I just want to be out here. I hear birds, the sun, all that stuff. But I wanted to ask you before we wrapped up here, if there was any piece of advice that you would give, from any of you really, in a caretaking side, as a patient side, what piece of advice would you give somebody that may be in the beginning of the journey too, like you were, just trying to figure out the answers?
I'm trying to think.
It's a loaded question.
Yeah, I was gonna say it's just
good question.
It's a lot.
Did you have something in mind?
Yeah, I mean, if you want to go.
I was gonna say my advice, I guess, would be to trust how you're feeling, because I think especially as I was getting into the process, especially when I didn't know what was wrong, there were a few moments where a doctor or someone would be saying to me like, well, nothing's showing up, so maybe it's just you. And I knew that wasn't true, and I knew that something was wrong, and I did have a few moments where I was like, maybe it is me, maybe there's something wrong, and I started to doubt myself. But ultimately, believing myself in what I was feeling and my parents believing me in what I was feeling was what led me to a relatively quick diagnosis in the terms of most people's porphyria. So I would say just trusting how you're feeling. You know best, like, what a porphyria attack feels like. You know what treatment works best for you. So I would just say trusting yourself and how you feel.
That's a good answer to a loaded question. But now I gotta switch over to mom and dad now. What's your piece of advice?
Well, I think that after passionately and aggressively advocating and knowing that you know your child best, and whatever you have to do to get what they need, so whether that be prior to the diagnosis or even after, I think we were blown away by everything that went wrong after the diagnosis. So I feel like being absolutely meticulous with the nurses and the doctors and the timing of the morphine and the timing of the heman. And I guess another thing would be if there is a nurse who is taking care of your child and you are not jiving with them and you feel as though they are not giving you the proper care, go to the nurse manager immediately and ask for the nurse to be moved to different patients and for you to get a new nurse. It doesn't have to be, a big blowout, but there were times where we held on too long because we didn't want to hurt people's feelings. And we should have done that much earlier because we feel like in the end, Claire paid even a steeper price in terms of her health when she was being taken care of someone who really wasn't interested in understanding the disease,
Yeah.
Does that seem reasonable?
Yeah, no, I totally agree with that. I mean, I think that as Erin said, and as we said, it was surprising to us that even after we were in a place where there was an expert and a team there, that we still ran into these situations. And I think becoming as educated as you can about everything so that you can fill in the gaps when you have shift change and you have people who come on who aren't as familiar. And I think we tried to be really reasonable early on, as Erin was saying, but we realized that ended up not that I don't think we were unreasonable, but that we really had to actively advocate and point out when people were making mistakes that we knew. I mean, given what we had learned before, and I don't know that is the way that we would have started this. We didn't start that way, and so those things, and I think too, as Claire and Erin both mentioned, leaning on your support systems. Our families, our extended families, were really great and helpful, and our friends, and I think without them, it would have been that much. It was hard to get through this, especially for Claire, understandably, but having people around us was really great, and I think being comfortable sort of leaning on them for support when you need it.
Right. So if they would, I learned that if they say, what can we do? And I would say, I need dinners for 5 nights. And they would go, it's done. And so I asked for what I needed, and we didn't try to do it on our own. And, so be sure to ask for help and receive that help.
And I think, even going back to what Claire said, is the fact that the diagnosis was quick due to just you guys just believing in how she felt. And I feel like because the average age for porphyria getting diagnosed, or average years it takes, is 15 years, it's just maybe they didn't have a support system that believed into them enough to push forward. Because, you think about it, as a porphyria patient, curled up in a ball with the abdominal pain all the time, you really can't advocate so much for yourself when you're in a ball.
No.
So,
Right. You got to have someone else.
And I think, we were fortunate that we had our friends who knew about this, that clued us into it. I think we were fortunate that we felt comfortable advocating and that we could participate in conversations and understand, for the most part, what was being discussed. And I would often, or at different times throughout those 6 months when we were in hospitals, think about people who didn't have that and weren't able to do that, and wondering about the care that their loved ones would receive. And I think that's the piece that I just keep coming back to, is like, you have to be comfortable with that. You have to do everything that you can to be able to advocate and to help, especially, we say this, but with Claire, when she was enduring her attacks, she would pass out from the pain. And I just thought, how can she go through this? And what can we do? We got to make this stop. Right? It's just awful. Yeah. And so, to expect somebody, and that's, we've said this before, like whenever we talk about it, even today as we're talking, I'm thinking, like, what if this would have been a year before, during the height of COVID, and we couldn't have been in there with her, with everything that happened. I can't even really think about it, because I just can't imagine what it would have been like.
It would have been bad.
Well, I thought that was a good spot to wrap up, but I wanted to thank you, because this was such a cool conversation, because everybody gets to see the dialogue between you guys talking, and how you felt opposed to how you felt during this whole entire process. So I'm grateful we were all able to sit down, being in different spots, and being able to have this conversation. So thank you.
No, thank you for inviting us and for doing this. I think this is a great service.
Of course.
It is a great service.
Thank you for taking the time out of your day to listen to our podcast. If you enjoyed this episode, please share it with friends, family, or anyone who could benefit. And please don't forget to subscribe and leave a review on your preferred platform. It helps us spread awareness, and we would be extremely grateful. You can also follow Rarely Discussed on Instagram, YouTube, as well as TikTok. If you're someone seeking diagnosis for porphyria, visit porphyriafoundation.org to receive a free doctor packet, forms for free DNA testing, and a list of doctors in your area. Stay tuned for more episodes of Rarely Discussed.